Hello everyone, my name is Alex Thorp and I'm a PGY1 pharmacy resident at the UIC College of Pharmacy, Rockford campus. Along with Jeremy Kosak, Thomas Carey, and Eva Morrison, who are pharmacy staff at the Swedish American Hospital in Rockford, and Christopher Shriver and Annette Hayes, who are faculty at the UIC Rockford campus, we would like to present the results for our project, Assessment of Medication History Accuracy and Completeness at Admission. At the Swedish American Hospital in Rockford, pharmacy technicians and interns are involved in the medication history process for new admissions at the hospital. Discrepancies between inpatient and home regimens can lead to harm and discomfort and have been found in as many as 67% of patients' histories. The most common discrepancies identified at other sites include omission, commission, incorrect dose, and incorrect frequency of medications. Both pharmacy technicians and students or interns have been found to reduce these discrepancies. Given this, we sought to identify the presence and number of discrepancies in patients at Swedish American Hospital in Rockford. To assess this, we repeated histories for 50 patients from October 5, 2020 through December 29, 2020. Patients were identified by reviewing patients that were currently admitted with histories completed by technicians and interns. The primary investigator repeated their histories and logged presence of any discrepancy in the history, percentage of total discrepancy of each type, and number of discrepancies involving high alert medications. We also completed a sub-study comparing technicians and interns to assess if discrepancies were more common in one group compared to the other. From the 50 histories, we identified 157 different discrepancies. The most common ones identified include addition of an omitted medication, removal of discontinued medication, and clarification of a dose. There were 15 discrepancies identified with high alert medications, which nearly all were due to missing sliding scale insulin doses. On average, there were about 3 discrepancies per history, and for every 3 medications on the patient's medication list, there would be an additional discrepancy. When comparing technicians and interns, it's important to note that in our data, technicians completed about 2 times the number of histories as interns. So even though technicians had more discrepancies in some areas, they weren't as frequent when considering the number of histories they completed. Also, there was no significant differences between any of the discrepancies between the technicians and the interns. That being said, when comparing the two, technicians were slightly more likely to commit a discrepancy of an omitted medication, which is often due to missing an OTC product, which the students likely did not miss due to their education in school. However, interns were slightly more likely to commit discrepancies of clarification of frequency, high alert medications, removal of discontinued medication, and removal of a duplicate medication. But once again, none of these were found to be statistically significant. Finally, we found that nearly every history had a discrepancy, with only 6 that had no discrepancies identified, and about half of the histories having either an addition of an omitted medication or of a clarification of a dose. So after discussing the results with the pharmacy team, we agreed to use this data to enhance the current training process, placing more of an emphasis on high alert medications and over-the-counter products. Also, the data is being used to provide specific feedback for each technician and intern to help them optimize their process. Using the data we collected, we're confident that we can continue providing quality care to patients at Swedish American Hospital and optimize our process to limit discrepancies even further. Thank you all so much, and please let me know if you have any questions.